name is Mark Zoland, and I'm going to be discussing how hernias are repaired. I'm a general surgeon, and this is a common question. This is not a substitute for medical care. If you have an issue, please see a doctor. What is a hernia is the first question in understanding how they're repaired. The abdominal cavity is made up of multiple layers within the abdominal wall. It is an actual defect in the abdominal wall of the musculature and some of the fascia. When there is an opening, something can protrude through. In this case, you can see either fat, or here you see an image of bowel that's going into the hernia opening. Symptoms are caused by compression of a nerve. The hernia protrudes outward and causes pain sometimes when it impinges upon the nerve. Inguinal hernias give you the purple distribution of pain. Femoral hernia is the green, and obturator the yellow. Hernias can bulge underneath the skin, and it produces a fullness in either the groin or sometimes in the belly button. Hernias are repaired by either an open classical method or a laparoscopic minimally invasive technique. When you do the hernia repair in the open technique, you have to make an incision. We make an incision generally in the groin area overlying the inguinal hernia. Once the incision is made, we do a dissection to what's going through the opening and remove that, and then we place a mesh in the open hernia repair, and in this case the mesh can be placed either above the muscle and fascia or below the muscle and fascia, as seen in this image here. Both are done routinely. When hernias are repaired without mesh, as some people ask them to be, and sometimes in athletes we do this as well, you can run sutures that closes the defect. The sutures usually are non-absorbable, meaning they stay forever. You pull the edges of the defect together. Laparoscopic hernia repair, or a minimally invasive repair, is done by making small incisions higher up. Usually there's 3 incisions, and when we do the laparoscopic hernia repair, we usually use mesh. Insufflation is used to separate layers, and small little openings are used to put the camera in. The dissection is done to open up the area where the hernia is, and then a mesh is placed into this space. Once the mesh is in position and covering the defect appropriately, the peritoneum is allowed to close down, and the mesh is perfectly sandwiched between the layers. I hope this answers some of your questions. Thank you.